I am Jennifer French, and I am the NDP candidate here in Oshawa.
What do you think the key priority issues are in your riding in this election campaign?
The key priorities have been coming up loudly and clearly at the doors. Folks are talking about housing, the lack of safe and affordable housing and stability when it comes to housing, the lack of real rent control. The cost of living is going up. Things that used to be free or affordable aren't anymore. And another thing that I have been hearing at the doors really has been about healthcare, this creeping privatization. You know, we've got We've had a premier in Doug Ford that has been allowing that privatization in our healthcare system, agency nursing. We're seeing our hospitals undermined, and people are telling real stories about wait times, not being able to see specialists. They have been talking about the cost that they're paying for user fees at their doctors, and those are some of the real conversations that we're having at the doors. So I would say cost of living, I would say housing, and certainly an erosion of our public services that we depend on.
If the U.S. puts more tariffs into effect, how would you want the government to respond?
Well, the question of tariffs and the threat of such instability with our relationship with the states is weighing heavily on everyone. Certainly out in the community, there's a rising level of anxiety and uncertainty. And it reminds me of what our community went through in 2018 when General Motors was abandoning our community. And we were also abandoned by the then Premier Doug Ford, who said that the ship has left the dock, and gave me heck for peddling false hope. But we stood together as a community, and I think that we're going to have to, whatever comes, we've got to ensure that we come together as a country, that the next government, hopefully an NDP government, but the next government works with all levels, federal, municipal. We have to ensure that we have a plan for income protection, that we have a plan for investing in industry, that we work with industry, we work with workers to ensure that we protect the jobs that we have. And then we also have to look to the future. We have to continue to be competitive, and that means investing in healthcare and education. We need an educated, skilled, healthy workforce. That has always given us a competitive edge, and we have always built the best products on the continent. And so we do have to have an immediate plan to come together, to invest, to do what it takes, to all be rowing in that same direction, but then also looking forward. And I'll say something else. Our community office does a lot of heavy lifting in the community, supporting folks. And if things don't get easier and if things get harder, we do need those community supports. We need compassionate work, and the government needs to be investing in agencies that do a lot of that compassionate work in the community. So working with all partners to support this community in such uncertain times.
It's estimated that 2.5 million people in the province do not have a family doctor. How would you fix the shortage?
I'm very glad to be able to talk about healthcare. It's on a lot of folks' mind as we've been door knocking, and the last couple of years serving as the member of Provincial Parliament for Oshawa. We have had so many people lose access to a family doctor, others who just can't get it. Some of the plans that we have as the NDP moving forward is to do what doctors have been asking us, to free up more of their time to work with patients, to see more patients. They've asked for admin support and to hire more admin staff so that they can see more patients. That's a piece of it, but we need to hire more doctors, ensure that more people are actually going into those residency spots, funding more residency spots, ensuring that those who go into family medicine continue on that path and find themselves in the community. So we're lucky here in Oshawa. Lake Ridge Health has partnered with Queen's University, and we have students here, but we hope that they will continue on those paths. And that means when young doctors or would-be doctors tell us they can't afford to open their own practice, that they want to be part of a family health team that has nurse practitioners, doctors, and the resources. Those are very successful models, and that takes government leadership and investment, and we've made that commitment to do that. But I also think there are a lot of folks that could be practicing medicine, but because they're internationally trained, there are so many barriers in the way. And I think being very thoughtful and purposeful in removing those barriers and figuring out what they are to ensure that more medically trained professionals can get into the field and practice, because we desperately need it. But it comes down to, we want to invest in public health care. Agency nurses are bleeding dollars into the private systems, and we need to strengthen our publicly funded, publicly delivered healthcare system.
With housing prices and homelessness at an all-time high, what would you do to make housing more accessible?
Thank you. There has been a lot of interest in housing, because whether folks are looking for a new home, whether folks are trying to stay housed, they're couch surfing. There is such instability when it comes to housing. So the NDP has committed to building 250,000 new homes over 10 years, and that would be affordable and non-market homes. We're not talking about McMansions. We're talking about supportive housing, wraparound services as needed. Everybody needs to be housed. Some folks need addiction support, community support in order to be successful and to be housed. And that requires investment as well. But a lot of the people that I have been talking to in apartments here in Oshawa, they're very nervous that they can't stay housed. So bringing back real rent control. And what that means is that we need to have strict regulations so that rent can't climb up, that these above guideline increases that are hanging over people's heads can't force them out of their homes. We're seeing rent evictions. We see such a terrible backlog in the landlord-tenant board. That has been totally messed up by this last government. That's a longer conversation, but we do need resolution, whether it's landlord, whether it's tenant. The system is in such a mess right now that people don't get the justice that they need. So first, we need to keep people housed if they have housing. We need to ensure that we are building appropriate and affordable housing, and fundamentally getting the government back into the business of building homes. When we think about after wartime, we saw these massive leadership investments and initiatives to house people. I think that is what is needed here, bold and purposeful initiatives to ensure that folks can have a place to live and trust that they can stay there.
What would you do to ease transit issues in the region?
Thank you. I have had the opportunity to serve as the official opposition critic for infrastructure, transportation, highways now for about 4 years. And I was very pleased to serve in that role, and also back in 2018 to bring forward a private member's bill to remove the tolls from the 412 and 418. It took 4 years of chasing the Conservatives, but we as a community were successful in having those tolls removed. But that's not enough. The 407 East is the provincial portion. It's still provincially owned, and it's the only toll road, and it only affects Durham region. So we have called for the removal of that for a long time, echoing the region of Durham. We've talked about taking the tolls off the 407 for trucks to move them from the 401 to the 407, and that's been a non-starter with this government. Marit Stiles and the NDP have said that we are going to work with the 407 ETR, with that company, to ensure that we can have a toll-free drive on the 407 for everyone. That's something that I've asked Doug Ford in the legislature, and they've danced around it, but they have not even opened those conversations. And that is something that was a public roadway sold for a song by the Conservatives, a totally bad deal, but we've seen a lot of those. And so working to bring that back to toll-free for all Ontarians. We have got to look at moving people. And when we have the 401 that is such a mess, and the 407 could be differently utilized, that absolutely has to be a priority. And I'll tell you what we're not going to do. We're not going to go ahead and build a 401 tunnel and dig up underneath the 401. That's a pipe dream of the Premier. But what we need to be doing is focusing on getting people moving, investing in public transit, and ensuring that we are best utilizing our existing public infrastructure.